everybody, and welcome to the Family Matters interview series. Thank you so much for choosing to join the presentation tonight, and we're so happy to have you with us. Just a couple reminders that all of the lines will be muted throughout tonight's presentation. So if you have any questions, you can enter it into the chat box, and somebody from the BCAT team will respond to you within 2 to 3 business days. We are pleased to have Dr. Susan Lehman joining us this evening. Dr. Lehman is the Patricia B. and William T. Bright Professor of Mental Wellness and the Clinical Director of Geriatric Psychiatry and Neuropsychiatry at the Johns Hopkins University School of Medicine. She is an Associate Professor in the Department of Psychiatry and Behavioral Sciences, where she oversees geriatric psychiatry clinical services at the Downtown Hospital and Bayview Medical Center. She directs the Geriatric Psychiatry Outpatient Clinic and Geriatric Psychiatry Fellowship at Johns Hopkins. She is a national leader in geriatric psychiatry and in geriatric psychiatry education. Dr. Lehman is interested in improving medical student and general physician education in geriatric mental health. She directed the psychiatry clerkship for the Johns Hopkins School of Medicine for 15 years and is a former president of the Association of Directors of Medical Student Education in Psychiatry. Dr. Lehman is the recipient of a number of national awards, including the American Association for Geriatric Psychiatry Educator of the Year. She has presented and led workshops at the annual meetings of the Association of Directors of Medical Student Education in Psychiatry and the American Association for Geriatric Psychiatry on topics related to medical education, aging and ageism, and geriatric psychiatry. In addition, Dr. Lehman has published articles, book chapters, and online educational materials related to medical education and psychiatric disorders in geriatric patients. She is particularly interested in late life mood disorders, especially geriatric bipolar disorder, mental health concerns in older women, and outpatient management of geriatric patients with psychiatric disorders. She is also co-editor of the recently published book, Bipolar Disorder in Older Age Patients. And tonight she's going to be talking to us about the benefits and limitations of memory enhancement medications for persons with dementia. Is it right for my loved one? And joining Dr. Lehman is Dr. William Mansbach, the founder and chief executive officer of Mansbach Health Tools and the chief executive officer and president of Counterpoint Health Services. Dr. Lehman and Dr. Mansbach, I will turn it over to you.
Dr. Susan Lehman, welcome to Family Matters. I'm really excited to be able to talk with you today. This is a series for families, although having said that, there are lots of clinicians who also listen in. And we'll talk for 20 or 30 minutes, and we'll be talking about the topic of memory enhancers or medications for dementias like Alzheimer's disease. But before we begin, if you can just, in a couple of minutes, describe a little bit about what you do and where you do it, and then we'll get to the substance of our conversation today.
Sure. Well, first of all, thank you so very much for having me here. It's a pleasure to be here speaking with you and hopefully also speaking to our listeners who are listening to us today. I'm a geriatric psychiatrist at the Johns Hopkins Hospital and Johns Hopkins University School of Medicine. And my official title is I am the Clinical Director of Geriatric Psychiatry and Neuropsychiatry. And in that role, I'm very much interested in taking on and direct both the inpatient and outpatient programs that we have for treating older patients with psychiatric disorders. In addition, I direct our Geriatric Psychiatry Fellowship, which is really charged with training the next generation of experts in the field.
That's great. Well, we're excited to have you. You have a wealth of experience and a great background, and especially for a topic that is very complex and creates a great deal of consternation, doesn't it, in family members and patients alike. We'll be talking about these medications that have been designed as memory enhancers. Whether or not they necessarily enhance memory and other cognition is a debatable point. But just as a point of clarification, can you describe a little bit about what this category of medications is and what it's designed to do?
All right, I'm not sure if this was what you have in mind, but I'm going to answer it in this kind of way, which is, first of all, we all are concerned about our memory. I think if there's one aspect about ourselves that we value the most, it's our ability to remember our people who are important in our life, to remember our own personal history, to remember things day to day. It's something that's a natural and human thing, and memory is very meaningful to us and gives meaning to our lives. And as we get older, I think memory has become something that becomes even more valued. So it's not a surprise that there's a lot of interest in things that can enhance memory. I think as a category, and you know this as well and better than I do, that we know a lot about things that enhance memory. Some are actual medicines and some are lifestyle things. I think when we're all students, we know if you get a good night's sleep, you'll perform better on the test, for instance. So just even things like that improves memory, is sleep, of course. And as we get older, I may talk about this later as well, sleep continues to be important. We know things like avoiding extra medications that can cause confusion also enhances memory. Even things like having a cup of coffee, which is a mild stimulant sometimes in the moment, can improve your performance. So there's normal parts of life, that aspects that can enhance our memory. But in addition, and this, I know this is really what we were going to be talking about, there are specific products. And I want to talk to you about, there are products that have been evaluated by the FDA, the Food and Drug Administration, and those that haven't. And I make a distinction because I really feel as a physician that we should be paying the most attention to those products that have been evaluated by the Food and Drug Administration, and particularly those that have been approved. And I will get to those, because there is a huge unregulated industry of different products that are marketed as cognitive enhancers. A lot of it is direct to consumer marketing, and these have not been reviewed by the FDA. They do not have FDA approval. So we have no sense about their efficacy, or, and this is really important, their safety. Just because they haven't been evaluated doesn't mean they could be unsafe to any individual, and it doesn't mean it may not have a negative interaction with what some other medicine somebody else is taking. So there's a whole field of unregulated memory enhancers that I think I'm really encouraging people to stay away from. In addition, there have been a whole category of supplements, the FDA, that have been reviewed, and there's good science behind them, and they're not effective. Things like ginkgo biloba, for instance, there was a lot of early interest, but a lot of good science is really not supporting it. So at this time, there are 4 medications actually that do have FDA approval as, I guess we could call them, cognitive or memory enhancers, and they really are approved by the FDA for cognitive memory treatment of Alzheimer's disease.
So this idea of there's a broad sort of supply even of so-called memory or cognitive enhancers, but the idea that many of them have not been approved, many of them are not regulated, and the issue of safety is really important. So it makes me think about why so many individuals take them. And it has to have something to do with the anxieties, the worries, maybe even sometimes a sense of desperation to do something. And so maybe we can address that a little bit and encourage that while we'll talk about medications, there are non-medication things that we must do, that we can do, that actually do have some evidence behind them to be helpful. But But so let me ask you, in your experience as a geriatric psychiatrist, you've talked with many families over the years. There are anxieties about finding something. Can you, I mean, at the end of the day, we want to help people manage their own anxieties. People who are watching this, you know, like, what can they do to sort of manage their own worries? What are some of the things that you tell families in terms of like their, I don't know, sense of almost panic at times about taking something?
Mhm. Well, you know, I think dementia is a scary condition for people. I would say probably most of my older patients are worried about their memory. They're worried about losing their memory, and understandably, because we all know people who have had dementia, and we know how we know people in our family, and we know neighbors, and as we get older, we know friends. We know famous people who have had dementia, and so it's a difficult journey, and it's sad. It really truly is sad for people to see an individual decline in terms of their memory and cognitive functioning. It's something we're all vulnerable to. Even the most educated among us, it's not 100% protection. Now, that being said, it's interesting that it's never considered a normal part of aging, such that there is no age where you would say, you know, by age 95, 100% of people have dementia. I mean, they don't. Even at age 95, it's about 50%. So there are some people who do not get cognitively impaired, and they're actually a focus of research as well. What is it about those individuals that has enabled them to have that kind of preserved memory and cognitive functioning? I think maybe it's just helpful just to review there are different categories and types of dementia as well.
Sure, I think that would be good.
And I think it's also important even to review that there are some, while dementia is not normal with age, there are some changes in memory that are normal with aging that are not considered precursors or like early forms of dementia. And so I think that's important to keep in mind, because it's very easy for people to panic when they have some of these normal changes with age, such as over the age of 50, it is very normal to have more difficulty remembering names and pulling up usually pronouns, names of people, names of movies, names of movie stars. The book author that you just read of the book you just put down the night before, that's really distressing when you can't think of a name. And I've been there too. It is frustrating. So sometimes we make a joke about it. We call it a senior moment. That actually in and of itself is considered normal with age. And that's important to know, because I see many people who panic, say, oh no, I can't remember that name. Now what does that mean? Usually what we're referring to is difficulty with noun retrieval. So it's not that the name is gone 100%. It's there. It's in longer term storage, but you can't pull it out at the moment. But it might come to you 10 minutes later that night, maybe the next day. Also normal with aging is more difficulty multitasking. I saw this when I was teaching our medical students and giving talks to them. They could do 4 or 5 things at once. They could listen to me. They could be searching the internet. They could be taking notes. They could be planning their dinner, and they could do it all. You know, I think as we get older, we can do more than one thing at a time, but not as well. So we're a little bit less efficient, a little bit slower in processing. It takes us a little longer to learn things, but we can learn. I think it's helpful to know what's normal, because we shouldn't panic in ourselves when we see these normal changes that happen with aging. But in dementia, what we see, and this is important to know, is that it really does involve a change in 2 areas of cognitive functioning from a higher level of functioning. So it's a change, and it means it's somebody who's now is cognitive functioning. They weren't born this way. It's a change, and it's in more than 2 areas. If it's only memory, we call it an amnestic syndrome. So it's going to be in 2 different areas, and it affects functioning. But that being said, so Alzheimer's disease is the most common form of dementia, affecting about 2/3 of people. But there are several other common types, actually quite a few, but there's vascular dementia, Lewy body dementia, frontotemporal dementia. These are all common ones. They present a little differently, and their time course is all a little different. And I mention that because the 4 medications that I said, that I just alluded to, that are approved by the Food and Drug Administration are approved for Alzheimer's disease. And we really don't have even FDA approved medicines for these other common dementias. I can, sort of speak about that. And we haven't really gotten to this, but I also think that, one of the things that's been frustrating is why haven't we, with all the research that's happened over 20 years, found a cure for dementia? And one of the reasons is it's so heterogeneous. There are many different types. And the more we even understand about Alzheimer's, the more we realize even Alzheimer's disease is heterogeneous too. And isn't, we can describe it, we understand it in broad strokes, but maybe that's not even as homogeneous, as we thought. So I think in talking to families, number one, I want people to understand what's normal and what isn't normal. So very often when I'm speaking to a family member who's concerned about a parent, they're also thinking about themselves, naturally, of course, too.
I'm glad you're making that point. I'm thinking about adult children who have a parent who's been diagnosed with, let's say, Alzheimer's disease. They have a moment where they have misattention or they can't remember something. So immediately they start getting worried because they are aware, usually not, maybe vaguely aware that perhaps their risk factors are greater because they have a parent who's been diagnosed with Alzheimer's disease. They worry, which leads me to a question, not so much for family members in expectations around their loved ones with a diagnosis of dementia or possible one, but rather what they can do for themselves too. I know that at our research center, we focused a lot on this Enrich program. How do you practice brain healthy behavior to try to lower the risk? The thinking being that if onset can be delayed significantly, then maybe the disease either will never happen or will happen with a more favorable sort of progression in some ways. And I'm reminded of a talk I gave to endocrinologist one time where I had said, do you talk about brain healthy behavior with your patients who are even in their 40s and 50s? And they looked at me like I was crazy. But I said, well, if you have type 2 diabetes, your risk factor for some of the dementias is greater in some way. So can you talk a little bit about what you would say to family members, even for themselves, the types of things that they could do maybe that are brain healthy and effective?
No, that's a really fantastic point. I think among the things that we have learned, over the years, is that perhaps what happens during the course of, say, Alzheimer's disease, eventually there is really death of brain cells that don't come back. Interestingly, we know that the brain changes that will in the future lead to Alzheimer's disease begin 20 years before the onset of any memory problem. That's remarkable. That's amazing that we now know that information, that the changes are happening so early, 20 years ahead of time. If we could make changes that could in our lives to help prevent that progression, wouldn't that be fantastic? Because along the way, we know that there are some abnormalities with, particularly, I'll say with Alzheimer's disease, the pathology, the working idea is that there are 2 particular proteins that become what's called misfolded. They change in their configuration, and then they lead to damage to the synapses, which are the communication points between brain nerve cells called neurons. And it's at those communication points that neurochemicals are transmitted that leads to communication going on effectively in the brain. When that gets poisoned by these abnormal proteins, then it leads to death of brain neurons. And the problem is once there is death of those brain neurons, they don't come back. And that may, and then it's hard to find medications that can really make a huge difference. So it may be that we have been working and focused so much at a point where the brain has been really damaged and it's hard to be able to bring it back or help it function. But if we could start earlier, earlier in the course and make changes, then it wouldn't necessarily lead down that pike. And so you're absolutely right. There's a huge amount of interest, and I'm so glad that your program is promoting it, and as you should, of what are the changes we can do in our lifestyle that promote brain health. And interestingly, everything that promotes good brain health is things that promote good heart health. So it's a 2-for-1. So if you do things that are good for your heart, they're also good for the brain, and we need both. You need a healthy heart and you need a healthy brain. So we know a lot of things that we can be doing starting in midlife or earlier. I mean, the earlier, the better. Things like keeping your blood pressure under good control, treating blood pressure, having normal blood sugar, treating diabetes if you have it, losing weight if you are very much overweight and at risk for diabetes. That is huge. Having a healthy diet. There's a lot of evidence to support the Mediterranean diet, which emphasizes lots of fruits and vegetables, healthy grains, fish, not a lot of red meat, olive oil rather than animal fats, stopping smoking if you're a smoker, exercise. We know, and this is really important and really exciting, actually, the one thing that we know that actually improves the size of the hippocampus, which is the part of the brain where we believe a lot of memory is stored, is exercise, aerobic exercise. And that you don't need to be a gym rat to, or be ready for the Senior Olympics to benefit from it. We know that just regular walking is excellent aerobic exercise. It's also good for your bones, and it also helps you stay strong. So good for that. And then also social connections are very important. We humans are such social creatures. And we know that having meaningful personal relationships is also good for our hearts and our brains. Sleep is turning out to be very, very important. I mentioned that earlier, that we know that a lot of memory, if you're learning something for the test, it's very important to sleep and not pull that all-nighter. Maybe a lot of people in the audience are done with their college days, and they might say, oh, gee, I wish I knew that when I was in college and I was staying up all night to study for the test. But we know that a lot of memory is consolidated during sleep with aging. We also know that it's during sleep that the brain clears out toxins. And so if you're not getting 6 to 9 hours of sleep at night, you're shortchanging your brain's natural ability to clear out toxic materials such as amyloid that could be building up and that could be, leading to future dementia. So these are all things that are under our control that we can do. And a lot of interesting research is showing that it's the combination of incorporating as much of these, aiming for all of these as you can into your life, that has a huge cumulative effect in promoting good brain health and keeping our brains healthy and keeping them functioning well. And perhaps also pushing off the possibility of dementia, as you said, until later in life, if at all.
So just to sort of distill where we're at right now. So we don't have terrific medications specific for memory and other areas of cognition. But we do know an awful lot about lifestyle changes that if we practice them as early in life as possible, that we think about when we go for those walks or go up the stairs rather than the elevators, that sort of thing, that it's not just our immediate cardiovascular health, but we're protecting our brain as we age to empower people, give them a sense of empowerment. Then if that's the case, and we might also want to think about, and going back to the medications a little bit, Susan, there are medications that have been effective. I think you would agree, that aren't necessarily cognitive enhancers, but might treat some of the related symptoms, psychiatric symptoms that often happen with dementia, things like anxiety or depression, to some extent, perceptual distortions like delusions or maybe hallucinations, that are in a different category than the memory enhancers. Can we just spend a couple of minutes before we finish today talking about those medications?
Yeah, absolutely. So I'm so glad you brought this up. One of the things we do know that with dementia, that probably nearly everybody at some point is going to have, in addition to difficulty with their memory or difficulty with organizing with tasks, some sort of symptom. We call them neuropsychiatric symptoms, whether it is depression, anxiety, difficulty with sleep, psychotic symptoms, as you mentioned, like hallucinations or paranoia. And those are all symptoms that when they pop up really undermine well-being. Good care of dementia is ultimately really much focused on improving well-being of individuals. And where we can't at all stop right now the course of dementia for any condition, the medications that have been approved by the FDA maybe for some people slow down the process a little bit. That's for some people they might, but they don't stop it and they don't restore memory. However, when we can tackle anxiety, agitation, fearful feelings, depression, we can do a lot to improve quality of life that improves an individual's ability to enjoy their family and to enjoy all the time that they have. One of the things that I counsel patients and their families about when there's a new diagnosis of dementia or Alzheimer's is to remember changes happen gradually. You're the same person today that you were the day before. And I always like to think about the glass as being half full rather than half empty, and always focus on what you can do and making the most of it. People who have memory impairment can still connect with their family and enjoy their family, still enjoy good meals, still enjoy walks, still enjoy social interactions. And those changes happen gradually, and we should work really hard to promote good health. Even for people who have dementia, we want them to continue to exercise, for instance, to walk, be active, have some mental stimulation, have social stimulation to promote the highest quality of life that they can have.
So as we come to an end, this time goes too fast, Susan. We could talk about this for a long time. I would love to do so. If we could sort of outline, maybe 3 sort of takeaways for families that would help them realistically manage their expectations, kind of think about things in a more positive way. What 3 things might you suggest that people think about?
Well, I mean, I think I have to be just straightforward and say at this time, we do not have any medication that substantially alters the course of any of the dementias, reverses it, or adds back memory. But there are a lot of medications that are still in the trial basis that are being looked into. And a lot of research right now is really focusing on earlier things that we can do, as well as maybe new models of understanding the brain and what's damaged in Alzheimer's that I think gives us a hopeful sense that in the next years, we may see more progress in the area. But I think it's important, secondly, to remember that, again, dementia changes gradually, and there's a lot that we can do to support brain health and function, keeping people an active and meaningful part of lives by treating neuropsychiatric symptoms, by working on involving the person who has cognitive impairment in stimulating activities, both with their family and maybe with good caregivers. We didn't talk about the importance of caregivers themselves, taking care of themselves. Maybe that's a topic for another discussion. That's important as well. And then I think recognizing that although we don't really know all of the causes of dementia yet, more and more we understand things that we can do that are under our control, that promote good brain health. You're never too old to start implementing them because they're good for life. But the earlier you start, hopefully the better the rewards are going to be.
I think that those are wonderful takeaways. I appreciate you sharing them with with our family members and with our audience. Well, Dr. Lehman, it was great having you. I'm going to ask you back again. I know that you have an awful lot of information and experience to share with our families, with our clinicians, and with our patients. So thank you for all you do, and I'm looking forward to talking with you once again.
Thank you so much. It's been a pleasure.
All right. I want to say thank you to both Dr. Lehman and Dr. Mansbach. That was a really helpful and informative presentation. I want to take this opportunity to invite everybody to become a member of our Enrich Brain Health program, if you haven't already, by signing up on our Enrich website. And if you're interested in learning more information about the BCAT Research Center, you can also follow us on Facebook, Instagram, Twitter, and LinkedIn. And just a reminder that if anybody has any questions, you can enter that into the chat and somebody from the BCAT team will respond to you within the next 2 to 3 business days. Right. Well, thank you all again so much for joining this episode of the Family Matters series. And we hope to see you again for our next episode in February, entitled The Caregiver's Journey: Barriers and Challenges that Caregivers Face when Caring for a Loved One with Cognitive Impairment and/or Dementia. I'll go ahead and leave the meeting up for just a couple more minutes in case anybody has any questions. And otherwise, I hope you guys have a great night.